Good afternoon and welcome to Beckers 11th Annual Meeting. We are so excited to have you join us for today's featured session sponsored by DocuSign, Healthcare Reimagined, Improve Patient and Employee Experience with Automated Workflows. Before I introduce today's panelists, I would like to go over just a few housekeeping items. Be sure to check out our resource section and other engagement tools on your dashboard. The session is being recorded and will be available on demand following today's event. We will send you instructions on how to access the on-demand recordings once the event concludes. Finally, we ask that you please fill out our event survey. At this time, it is now my pleasure to start today's program by introducing our presenters. Christina Wong. Christina is the Senior Product Marketing Manager, Regulated Industries at DocuSign. Christina has a diverse background in regulatory affairs and marketing, and she now leads the healthcare and life sciences product marketing vertical at DocuSign. Manish Kumar. Manish is the Director of System Solutions at Midwest Institute of Minimally Invasive Therapy Health. Manish has years of proven leadership, management skills, and knowledge of data. And finally, Michelle Stansbury. Michelle is the Vice President of Innovation at Houston Methodist. Michelle has been with Houston Methodist for 25 years, where she has deployed Epic to its main academic medical center and physician practices and led the team in digital innovation initiatives. At this time, I am pleased to turn the floor over to Christina to begin today's presentation.
Thank you so much, everyone. I am Christina, and I am going to be moderating today's panel. But just before I do so, I wanted to give a brief introduction of who DocuSign is. So you'll see here, the next slide, that we have a lot of various healthcare organizations that use DocuSign. We've been in the industry for a very long time with over 1,400 healthcare providers using DocuSign, more than 100 health systems, and many of our ecosystem players. We are used from, when you think of us, it's all about the agreements or the paperwork and documentation and how they get prepared, signed, then acted on, and then managed within your EHR. So whether it's a consent form or a vendor contract, HIPAA releases, HR paperwork, supplier agreements, you're able to digitize that workflow using the DocuSign Agreement Cloud product suite that we have built. So here to just kind of kick off the discussion that we have with our wonderful panelists of Michelle and Manish, I wanted to start this off with a quote from the New England Healthcare of Medicine on the next slide. You'll see here the New England Journal of Medicine that this is a quote from them when the COVID-19 pandemic began, was in the face of the COVID-19 outbreak, Americans are waking up to the limitations of their analog healthcare system. It seems to be clear that we need an immediate digital revolution to face this crisis. And that's where we're at today. You know, we are no longer in a crisis, but we're looking at how can we start to take where we're at, start to think about and recover in this pandemic and crisis in a new way that really transforms the industry, that we can reform it to be able to meet the needs of our patients, clinicians, and employees. And that's why we have some of our two most leading experts who's implemented some really innovative technologies about how we can reimagine healthcare. How can we start to think about how the industry has shifted and what's going to stay and what's going to change, and how we can make real change in being able to implement some of the neat things that are in front of us so that we can continue to meet our future and have wonderful solutions to be able to provide to our patients. So why don't I go ahead and kick off the panel with our first question, which is, if you wouldn't both mind giving us a brief summary of your organizations and what role you play in this effort. Manish, could you kick us off?
Yeah, absolutely. First and foremost, thank you for having me on this webinar. A little bit about Mimit Health. So Mimit Health is a multi-specialty private practice based out of the Chicagoland area, and we primarily specialize in vascular services. We have been in the industry and in private practice for over 15 years now. And my role there is as Director of Digital Systems and Solutions. So my duty and responsibility is to oversee all the systems that we use within the practice and find new solutions on how we can keep optimizing and keep innovating and be able to serve the patient and have higher quality of care. Awesome. And I'd like to hand it off to Michelle.
Sure, thank you. Also agree, really appreciate the opportunity to be on this panel and talking with each of you. Again, Michelle Stansberry, Houston Methodist, courses in the Houston area. We're an 8-hospital system, a research institute, a physician organization, and our innovation initiatives have been going on, at least our digital health, I will put it that way. We, of course, have many innovative solutions from our research and our clinicians, but our digital health journey really started about 4 years ago. And mostly because we wanted to increase our opportunity and provide the services that our patients want to see in a way that they want it. And also, how are we making the services that our physicians and clinicians provide much easier than a way than they have previously done before, and also our employees. So I love it, Christine, that you kind of brought it up. It's kind of, threefold. A lot of times we think it's just about the patient, but it clearly is about the other two as well.
Thank you, Michelle. I completely agree. That's why we like to always think about it as there's several parts of this a large healthcare organization, and you have to remember all the aspects that have needs as well. And so that's a perfect kickoff into how do we reimagine healthcare? What are those, how are you envisioning healthcare permanently shifting regarding the patient, clinician, and employee experience? What are you doing to address this? Michelle, why don't you kick us off here?
Sure. Well, what I would say is I think we've all learned a lot here in this past year and what we've been dealing with COVID, and also, just kind of the vaccination efforts that are going on. Previously, before, I would tell you virtual health was something that, some people were doing, not doing a lot of it, didn't have a lot of adoption. What happened to us? We all got used to it. We were kind of forced into that situation. And, it was a great technology to allow us to continue to care for our patients since we couldn't see so many in person. But, Houston Methodist kind of takes this concept of this know me. How do I know you better as a patient or a consumer in a way that we can make sure and provide the care the way that you want it? How do we know you better as a clinician and physician so that we can ensure that you have the tools and the services in a way that you want to provide to your patients? And again, from an employee perspective, we look at that same concept. So if you take those differences and look at, from a patient perspective, I think we've all kind of gotten used to living on our phones and technology. I mean, look at what are we doing here today? And so I think if you want to reimagine healthcare, I think what you have to think about is people in their busy lives and how can you provide the healthcare in the way that they want it? And that isn't necessarily always in the four walls, and it isn't necessarily always on a laptop computer. And how are we making that easier? And I would just say that goes along with, even your clinicians and your employees. And how can you get information to them in the way that they're wanting to get to it? So it's quite different. And I know that, people might say virtual health it had its purpose, but it may be going away, but I don't believe that.
Manish, I think you all know about virtual health. I think what you've done here in getting your telehealth practice up and running in a matter of weeks and the ability to be able to scale globally is a testament to the need for virtual. Do you mind telling us how you're planning to envision this new future of healthcare for the patient, employees, and clinicians?
Yeah, absolutely. And going back to what you were stating, when the pandemic first hit, we didn't really have a telehealth solution in place. And doing the investments prior with Salesforce, DocuSign, and being able to utilize those technologies really help us put the solution in place and get that telehealth up and running within 48 hours once the pandemic hit. When I look at reimagining healthcare, it's really understanding the patient's perspective, the clinician's perspective, and the phrase that I always look at is seek to understand before being understood, right? So you want to seek to understand the patient's perspective, understand their problem, and how you're going to solve that problem, and utilizing the technology enablement to do so as an organization in the healthcare industry. So for us, it's really looking at how you can keep innovating, be agile, and be proactive, and being dynamic and being able to shift towards the patient's needs and shifting towards the clinician needs. So one of the things that actually Mark Benioff says is he says people are meant to speak, not meant to type, right? So the clinicians just want to speak, they want to take care of patients, and we got to make sure that we keep innovating where it makes it very seamless for them, makes it very easy for them, makes it all the information is organized in one system where it's really accessible and makes it easy for both the patient and the provider and the clinicians to communicate.
I love that, Manish. I think where I wanted to draw deeper on is you talk about one system. And I think it's been really neat how you've been able to connect your tech stack together and really make it easy for all three of the people that we've been talking about. So can you describe your DocuSign journey and what pain you were trying to solve in meeting these future needs of healthcare and how it fits into this seamless sort of tech stack that you built that you've kind of hinted around in your last answer?
Yeah, absolutely. So we use Salesforce. It's our wall-to-wall platform. It's integrated with our EMR as well as our practice management solution. And we use Box, which is a cloud storage organization as well. And that technology has been integrated with Salesforce. So where DocuSign really plays a role is in our guided workflow, right? With the e-signature side, with patient consents, we do a lot of outpatient procedures. So we're able to deploy all these consent forms, get the HMP, the registration, everything done through the EMR and being able to get those documents signed before the patient comes in. And we've seen pretty big business impact on the organization because this allows you to speed up the time and labor efficiency for all the team members involved when it comes to patient engagement, revenue cycle management, and even doing credentialing for the providers. So having Salesforce, Box, and DocuSign all integrated together and that workflow behind it has been tremendous for us.
What I like about your story when we think about reimagining healthcare, and right now we started the conversation with thinking about it from a person of the receiving end, but then your story kind of highlighted how technology is actually part of the infrastructure that helps your employees and those behind the scenes be able to have healthcare reimagined for them and what their daily life or administrative burden could look like in a new future of healthcare.
Absolutely. And, we follow the 6 rights of a system, which really looks at your, having the right structure, the right people, the right processes to have the right information to make the right decision and give you the right rewards, right? So when we look at technology enablement and looking at reimagining healthcare, we really need to follow the 6 rights of the system. And even for looking at how can we push this forward and making it easier and seamless for all parties involved.
Thank you. And Michelle, do you mind helping us understand how Houston Methodist embarked on their DocuSign journey and what pain you were trying to solve to meet this future needs of healthcare? And in particular, I think what's really neat about your story is that you're not a Salesforce shop like most healthcare providers. And I think it's easy to first say, well, we don't have this brand new tech stack to start over again, but you're innovating on your current tech stack that's been there for a long time and describing that journey and how you're able to innovate with the tools that you already had and updated, I think is really fascinating.
Sure, and what I would say is, it's take a very large health system, such as what we have, and, take the even just of, patients coming into our system, employees come into our systems, contracts, things that need to move through the system, signature process. I mean, those can be very cumbersome when you're talking about a very large health system. And so, one of the ways that what we looked at is how could we take this very paper-based system, or a system where it is that you're having to get patients sign on a signature pad, which of course during COVID wasn't something that our patients really wanted to do. But, we looked at DocuSign to be able to say, how could we increase the efficiency of our organization by being able to send these documents electronically, sign them electronically, file them into our EMR, file them into our document management system, into our financial systems, into our HR systems, to make things much easier, instead of having to wait on that process to go through. The other thing that we looked at, and I can tell you probably for any of the large health systems that are joining here, if you look at the registration process for patients coming in to get services, trying to get insurance, trying to get pre-authorizations, everything else, we have a process where we try to fast track that so that we can, get that done very quickly. And one of the great ideas that I will tell you, and this is what I love about innovation. Innovation always isn't about just net new technology and adding it. Sometimes it's just looking at current process, what you have and what technology you do already have in-house to make it useful. We already had DocuSign in place. We already had our systems in place, but we had a group of our patient access individuals looking at why are we spending this time of sending over documents or having our patients sign these documents when we come in, when we can use this process such as DocuSign. It will tell you it sped up their fast track process tremendously when we moved towards that. So, what I would tell you is even from innovation and digital solutions, it isn't always about the latest and greatest fancy technology that's out there. It could be just looking at what you already have in-house and what more could you be using it with.
I like that. I mean, when we think about reimagining healthcare, sometimes people might think it's big, drastic changes, but it's not necessarily a big, drastic change. It's really looking at what are those key critical workflow processes and how do you optimize or bring in what you're already doing and being able to get it more efficient. And I don't know if any of you want to just elaborate a little bit more about that particular part. I know, Michelle, even about the current workflows into Epic, that typically there's questions that probably your colleagues have about, well, Epic is a complex system and how you're able to make sure and describe that sort of connection was successful.
No, I will tell you, and yes, a lot of people think, how can you integrate and, get things into Epic as easy as possible? And sometimes it's not. But, we have a really great relationship with Epic, as, most of our vendors that we work with, because they really understand what we're trying to do is make it easier for the patients. That's simply it. And how can we do that in such a way that it's not cumbersome for them or cumbersome for our staff or cumbersome for our clinicians? So, the recommendation I would say with anyone, and I know people always go, well, wow, how did you, get to a point where you're creating such this innovative environment? Look at the problems you're trying to solve. It isn't always about this flashy new net technology that's out there that's really great, but what problems are you trying to solve that you can either make a process change or look at, technology you already have in place. Because I would tell you, there's a lot of things that you can do with what you already have in-house without going and buying something new, or partnering with your current vendors that you're already working with to help you solve some of those problems with innovative solutions. It is one of the things that Houston Methodist prides ourselves on, is really working and partnering with our current vendors.
So my next question is, well, I really appreciate all of the guidance and advice that you have for your colleagues. And I think some of your colleagues might be thinking, well, things were great before COVID. And as we start to get vaccinated, people are coming back to in-person visits. telehealth, yes, while it's important, we'll see it taper off potentially. What advice do you have to those that maybe have doubts or don't want to necessarily invest in something when the old way seems to kind of work for them, and that they can continue to see a future moving forward with the way that things were? So, Manish, do you want to start with that one?
Yeah, absolutely. You don't know what's going to happen tomorrow, right? So when the pandemic hit, not everyone saw it coming, first of all, and it really accelerated the digital health in the industry. So, what I would tell people is when it comes to accessibility, and for example, when you shop at Amazon, you're really satisfied with the service, right? We want to be able to do the same thing in healthcare and be able to provide that accessibility, provide the same quality of care, and being able to make it very easy and seamless for the patient. So I would tell people, you don't know what's going to happen tomorrow. So it's always good to stay ahead of the curve, because at the end of the day, you don't want your organization to go downhill due to constraints that you have because you don't have the technology to be able to sustain it, right? And I think that's very important to look into when you look at it from an investment standpoint versus an expense standpoint for your organization.
Hmm. Michelle, do you have some
Sure.
advice there?
Sure. The only thing that I would say, we've seen it at Houston Methodist, large increase during COVID. As COVID is, now that we're getting vaccinated, we're starting to level off on our virtual visits. But we believe virtual health is more than just a telehealth visit from an outpatient perspective. We offer lots of different virtual services within Houston Methodist, not only just from an outpatient perspective, and I do think it will continue to stay around because we are a society who are an extremely busy society, and we create our schedules in a way that is not convenient to always go in for a in-person visit. So I do think it will stay around. I do think that, we have a population of patients who like the option. And I think as you see more devices being added to that virtual visit, which allows clinicians to then give a better diagnosis without having you coming into the office, it's just going to enhance it even more. But as I said, for us, virtual health just isn't about a telehealth visit. On an outpatient side, we do a lot with our virtual ICU projects that we have, other types of virtual visits that we are doing, within our hospital environment, from teleconsults to telerounding. So I do believe that it's here to stay. I do believe that there is a lot of value in what you can offer from a virtual perspective, and not just thinking from the outpatient side.
And I think as the demographics start to change, when you think about Gen Z and the future generations, they're just going to be more used to having those conveniences. And while we need to think about what their needs are and where that growth opportunity is, and I think that's what I really liked about your comment too, Manish, is about how do you invest in your organization and not necessarily always think about the cost piece, but invest for that future and what you think that could bring. And I know what's interesting too, that you might be able to add some perspective on, is your ability to scale and grow globally. I envision that wasn't necessarily in the cards at the beginning, but as you continue to invest in Mimit Healthcare, in the technology, it opened up new opportunities that potentially you never thought of at the beginning. Do you want to talk a little bit about that story of scaling and globalization?
Yeah, absolutely. We scaled from we were doing services in one nursing home, and we went to 55 in 1 year due to the technology enablement that we have. And if we didn't have that technology and being able to look at our workflow per departments, we wouldn't be able to scale that fast. Now with COVID hitting us, we're able to shift to the virtual side and being able to do the telehealth visits and whatnot. And we needed the technology to sustain that. But once again, it goes back to making sure that everything's aligned within your technology side and your operational side as well. So I think it's very important when we look at that. And one of the things I always tell people is, for example, if you're a personal trainer and you have a local gym, is that a scalable business or is it a limited scalable, right? But if you're a personal trainer and you have Zoom and you can offer classes online, that becomes a global scalable business, right? So we look at it from that perspective too, on how you can really outreach to a large community and solve problems at a global scale.
And you brought up a really great point in that answer about this connection about aligning technology initiatives to your operations. Can you please discuss that a little bit more? And in particular, even though it might be using your existing tech
Sure.
stack, or change is change. So a little bit about the struggles around change management as well.
Yeah, absolutely. So we use a learning management system for our change management. It's really good to be agile. It's really good to be innovative, but you need to make sure that your end users are learning as well. They're not, out of the hole. So you need to have an LMS system where they can look at it for reference and really understand the process that they need to follow, even for new employee onboarding as well. And when we look at the operational side and looking at the systems perspective, that alignment's super important because, for example, if your EMR has exam room 1, 2, 3, 4 color coded in some way, when you go to the infrastructure and you go to the facility, it should match the same thing in the system. So it doesn't become very confusing, right? And it shouldn't be, where you go to the facility, it just says exam room 4, 5, 6, but in your EMR it says 1, 2, 3, 4, right? So that alignment becomes very crucial, and making sure that the workflow really follows with the operational side as well.
Michelle, would you like to chime in?
Oh, I would just say, no, I agree with that. I mean, when you've got an organization that's almost 27,000 employees, I mean, definitely, yes, you've got to have, structure in place, LMS systems. We even have, personal trainers. I mean, whenever we make changes or do things with an Epic, we provide kind of at the elbow support to our providers. I mean, it's extremely important, as you're trying to, you've got several big systems that support all of the different functions within a hospital, a physician practice, I said research, all of that. So, it is important that you have the right systems in place to be able to support each one of these groups. So I don't care if you're small or you're big, it's just extremely important that everyone understands the workflow for their specific area and how it's best done for, the institution and the patients as a whole.
Do you think it's necessary to have an advocate in order to have successful change?
What I would tell you is we utilize champions within, and we use a change management process. It's called ADCAR. And the root of that is, what does this change mean to me, right? How is this going to affect me? And those are some of the things that we really build into overall from our change management and the structure of bringing it to any of the constituent groups that we're working with. But yes, I do believe that it's important that you have a champion that's out there that's helping to support overall the change within the organization.
And I'd like to echo off that. It's important to have a communication strategy as well. So it's, there's one thing where you see change management, but how do you communicate effectively with your employees and making sure that they understand it? Because adult learning, everyone learns a different way. Some people learn visually, some people learn, when you write it down, everyone has a different way of learning. So it's really important to understand who you're teaching and how to teach them, little bits and pieces, looking at the objectives and really going through a quiz, going through it like school, essentially, right? When you go to school, you go to a course and go through the proper curriculum and whatnot. So I think that's very important as well.
Yes, thank you for that. And one thing that we've noticed too, that I think a lot of our clinicians particularly want to see changed, is that they spend so much time having to be behind the computer. There's a lot of administrative burden that happens for them to have to type instead of having that human to human interaction with their patients that ultimately leads to more trust and better outcomes. And so I would really love to hear from you both about how you're using technology to be able to bring voice or other technologies to scale your business, or be able to help alleviate some of that pain that some of these clinicians have, to help improve that patient experience that clinicians have with their patients.
Sure. I mean, I'll start. I will tell you, a lot of people ask me, where do you think, what's the future of healthcare? What is the biggest, what is the technology that people should be focused on in the future? I firmly believe it is voice. Voice is kind of is where we should be focusing in. We're used to it today. I mean, how many people have Alexa devices in their homes? How many people use their phones to use their voice to place orders, to do anything? Well, the same thing needs to occur if you stop and think about healthcare. You're absolutely right, Christina, that our physicians, while EMRs have been great for data, great for best practice care, it has really had the clinicians in front of a computer and not necessarily in the face-to-face with their patients. 2 years ago, our CEO said, really, I want you all to focus on it. I want my physicians back in front of the patients. So, while we know there's other vendors out there that do ambient listening today, they couldn't do everything that we wanted. So we chose to partner with 2 organizations to co-develop our own voice solution for our physicians for ambient listening. We also are trying to work on how can we utilize voice within the hospital, not just in the clinical practice. One of the things we're piloting right now is voice within the ORs. How can our surgeons be able to utilize an Alexa type device and we call our devices MIA, Methodist Interactive Assistant, but MIA, bring up, the last PACS averages. MIA, let me see the last labs, or the start a case, stop a case, start the tourniquet, whatever. We've got that now in a kind of working pilot mode within our ORs. We're now really looking how we can scale that to nurses. So think about your nurses of really talking, with their patients and having to document in the EMRs. The other is we're looking how our patients can use voice. Voices within the hospital setting, voices within their home setting, and then also our employees. We're really looking, you can actually go right now and we have an Alexa skill where you can apply for a job at Houston Methodist just by using your Alexa device. So I do believe voice is a convenience. And just because I think people sometimes think, how can you do that in healthcare? You can.
I agree with you. And for us, we partnered up with Sirina, which is, recently just got bought out by Nuance Dragon. And what we realized by using voice, I think voice is very important. Our clinicians, we're serving in all these nursing homes. They're able just to talk and spend more time with the patient. They don't have to be in front of a computer and looking at the notes and start charting. So it became really crucial for us to really invest in this because it made it very seamless for the provider and the clinician, as well as the employees. And to an extent, it really got us to really think about structured data and how do you really get that structured data into your EMR from that voice, and the ambient mode side too, which is something that we're utilizing today as well. And I think that really will increase productivity, and I truly believe that is going to be the new innovation in the next few years within the healthcare system.
I love this idea of that's part of the reimagining, just thinking about voice and getting the physicians back with the patients. And I think what's interesting for I think a lot of your audience members that they might be thinking about is, well, I don't have a center of innovation or the resources that Houston Methodist has, or I'm not, with Mimit Health with Salesforce and being able to be small and nimble. So what would you say to these organizations about how to get some ideas that you guys have maybe posed in this webinar into their organizations or practices when they might not have some of these resources that you both have talked about? Manish, do you want to start?
Sure. So for us, when I first started off at Mimit Health, we were only 12 people. We were very small, right? So it's all, it's really about thinking, having those ideology and seeing what can fit your needs. And when you invest in the technology, you will see that return on investment once you execute it through. So when we look at the resources and everything else for everyone out there that's small, mid-size, it's really looking at the investment that you're putting in today and looking at your short-term and long-term goals that you want to achieve with it, right? So it's really looking at They call it the stairway to heaven model, and you really look at what you're doing now and how can you level up to go to level 1, level 2, level 3, and level 4. And you really dictate your objectives and your desired results, and then how do you want to produce those outcomes? So,
Michelle?
Yeah, I would just say sometimes people think for a larger institution, it's much easier than a smaller. I don't know that I would necessarily agree with that. I mean, but anyone, here's what I tell people, anyone that is thinking that, oh, well, we can't do innovation simply because of our size or for our financial funding, what it would do is challenge you to look at your own staff. We get some of our best ideas from our own staff of ways that we could increase our efficiencies, things that we can do. And it isn't always necessarily, as I said, buying a net new technology. I think there's lots of ways that you can do that. The other way that I think, how do you learn? I have never seen a community of healthcare that is so willing to share ideas and things that have been done as, everyone that's overall in this industry. And so I would say, reach out to your colleagues, reach out to, myself, Manish. We are more than welcome to want to share some of the things that we have learned and things that you can do. What's the pitfalls? Yes. Have we had pitfalls along the way? Sure we have. And we've learned from those and we're willing to share about those. But I want to encourage everyone, don't think it's about spending millions of dollars to always just get to innovation.
And that brings me to my next question is how do you know what to invest in? You don't always want the shiny new thing. You want something that maybe has been there already, or it comes for your employee. How do you know what you really want to place your bet on? I guess, Michelle, you could start.
I will start. It's at the core of what I told you is our Center for Innovation. What we're trying to accomplish is better provide this know me experience, right? So then you begin looking at what problems are you trying to solve in each one of these areas to provide that better know me experience. Then it absolutely comes down to, I will tell you what we do is we look at a family review of products within this group. And out of that best family review, it could be a brand new vendor that's out there that's just getting started, but is looking for a large health system to take their product and help develop it further. Or it may be a vendor that's already well developed, that already has a good product that we need. Or like I said before, it may be a vendor we're already working with and we want them to work with us to co-develop or expand the functionality of their product. So we don't take it just in one approach. We have multiple approaches that we look at it. But the one thing that I will tell you, and we are very fortunate in that we are able to try brand new technologies. And if they don't work, we quickly fail them. We don't keep trying to make them work. We just quickly say, nope, it did not work for our organization, but we learn from that and how do we apply it for the next option that we're looking at.
Manish?
Yeah, it's to echo off Michelle's point. We've done the same thing. We invested in some technologies where it did not work and we get rid of it, but we have a learning lesson from it, right? So, and I think that's really important. For us, we really look at what do you want to achieve and what's your strategy? For us, it's really taking care of more patients, right? So when you're investing in more technology and looking at the different workflows, you look at the priority? Is it solving a problem that's mission critical? Is it an important problem that you're solving, or is it nice to have, and you really prioritize from that basis. And when you're prioritizing from that basis, it really lets you know where you need to invest and which problems you're solving at the highest rate.
Great. I just love that tech and healthcare have more in common than you would think about that fail fast mentality. So I want to just kind of start to wrap this up. This is something that we kind of haven't hit on a lot, but I think is top of mind for all of us, not only culturally, but also in healthcare generally as a top topic is there a way that technology can help improve inequity that we see today? And inequity in healthcare we know is very deep, and it's not something that's easily solvable. So there's no way we're saying technology can solve this. But is there a role that technology can play in helping us with some of the inequities that we see here today?
I will start, Christina. I mean, yes, I am very hopeful that, the inequities issues that are around the country and even in healthcare, is spotlighted and done something. Where I would say technology would help in the one aspect is the data. What is the data that is coming from some of the, of what we're just seeing and overall within the inequities? What are some of the communities that we need to be, better serving and providing care for? Technology doesn't solve everything. And I will tell you, we're trying to work on a different problem. But what I've tried to, instill overall in this team is, let's not think that technology solves everything, because it doesn't. Technology can help it, but it won't solve it. And so while I would say it's a problem that we all need to address, I don't know that technology is going to be the magic answer for everything.
Yeah, and I agree. I think technology can help it, and data is the new oil. So, having coalitions and health exchange to really look at the data, get that analysis, and see where those communities are lacking healthcare services, and then making a decision from a higher up level, where it comes from the government and whatnot, to see how we can help those communities and really uplift it so that they're getting the right care, right? And I think technology can help it, but it ultimately comes down to the society and the infrastructure that we have in our country today. And how do you really make sure that people are uplifting those communities, they're helping each other out? And it really goes back to that human to human touch, right? Technology does not have that human to human touch. People to people have that. So
I love this idea of just humanity and being human, and that's what healthcare is about, and that's what we're seeing today in the news. And I think we all want to be part of the solution here. So, any last words either one would like to part on before we do takeaways and next steps? Manish, would you like to start, since you're the last one to talk?
No, I just key takeaways, and just when you're looking at technology and digital innovation, really look at the full holistic 360 view of what problems you're trying to solve, and how that investment that you're going to be making into the organization will make sure that you're making an impact on your mission and your vision, right, from a strategy level. And for us, it's about taking care of more patients. So everything that we're looking at from an investment standpoint has been here to, number one, take care of more patients and make sure we're giving higher quality of care. So I really think, take into considerations all these factors and really look at the bigger picture, especially in healthcare, and looking at what you can do next to be proactive and agile as well.
No, definitely, I would say I agree with Manish. The only thing that I would add to it, I mean, we take all that into consideration, but I would also, what I would say to everyone out there is, don't afraid to try. Don't afraid to try new things, keep reinventing yourself, keep, imagining how things could be different, and really listen. Sometimes I think we always feel like we have the answer, but it would be amazed at how much more you'll learn if you'll listen to those around you. And when I say those around you, I mean your employees, your physicians, your clinicians, and your patients and consumers.
Thank you. So just to wrap it up for the next slide, I think, we've really talked a lot about this patient experience, not only for just the patients, but the clinicians and the physicians, and making sure that you're investing in your organization and wanting to make sure that you're looking at this future of healthcare, that it doesn't have to be something net new, but it could be something that's existing, or it could even come from your own employees, but it's really about the investment versus the cost. And having an agile, adaptable, and flexible technology stack that's also connected with your operations is really important to facilitate growth and meet sort of unexpected changes that could happen. And then lastly, change management, security, looking at ROI are all successful pieces for a successful technology implementation. But we really are talking about bringing the humanness back in healthcare, so we can get our physicians focused on the patient instead of on their computers, being able to leverage maybe technologies like voice or DocuSign to help be able to alleviate some of these administrative burdens that really does in the end help with the patient and potentially better outcomes. So just lastly, please stay in touch. We are here for you to learn more resources. My contact information is right there. We have a white paper right there, and I wrote, I created a tiny URL that's like Future of Healthcare DocuSigns. It's like HCDS there, but really this is kind of a summary of how DocuSign, Mimit Health, and Houston Methodist has worked together. So we have this in writing as a follow-up asset that you could download, and of course visit the website. So thank you again, and I will turn it back over to Maddie.
Great, thank you so much. That is all the time we have for today. I want to thank Christina, Manish, and Michelle for your time, thoughtfulness, and insights. I also want to thank DocuSign for sponsoring today's featured session. And to our attendees who joined us, thank you for making time to be a part of our 11th annual meeting. Make sure you check out the other amazing sessions we have going on during this event. And please let us know if you have any questions, comments, or feedback. Thank you again for joining us, and we look forward to seeing you at future Beckers events.